Okay, diabetes insipidus is a condition in which a person will lose urine all the time. So a good way to tell what diabetes insipidus is, if we go into the desert and we don't have any more water, ordinarily our kidneys will stop making urine to conserve water. Now, a person with diabetes insipidus, if they go into the desert and don't have any water, they will keep urinating until they get very, very dehydrated, and they will die of all that water loss quite quickly. Partial diabetes insipidus means that you will continue to lose water, even if you're not drinking, up to a point. And then at a certain point, your kidneys will begin to conserve water, but not as well as normal. So this will lead to a lot of dehydration and other problems. Fortunately, Mother Nature will turn on our thirst center. So anybody with diabetes insipidus, be it complete or partial, as long as they can drink water, will not have any health problems. They should just follow their sense of thirst and drink the amount of water that's necessary. Rarely there are certain medicines we can give that can actually help a person with partial diabetes insipidus to cut down on the amount of water that they need to drink. They'll still need to drink more water than the usual person to avoid dehydration, but we can cut that down dramatically with the use of these medicines. The two most common types of kidney stones. The most common is composed of two chemicals, calcium and oxalate. And we talked a little about that on the air. Is the oxalate is part of our metabolism, as is the calcium. The second most common type of kidney stone is called hydroxyapatite, and that is calcium and apatite. Now that's spelled A-P-A-T-I-T-E, not appetite like food. And those two chemicals can also form calcium kidney stones. The best way to approach this is anybody with kidney stones should be drinking enough fluid in a day to make about 2 quarts of urine, and that means they need to be drinking about 8 to 10 glasses of water a day, because by flushing those chemicals through, they're much less likely to form any kidney stone, be that an apatite stone or an oxalate stone. Now, people with apatite stones, we will often use certain medications to cut down on the amount of calcium in the urine to decrease tendency to kidney stone formation. So that's the most common thing that we can do to help.